Doesn't help. I'm still,
It's all right. It's all right. That's how we're opening the show today, everyone. Good afternoon. This is the Science Dispatch podcast. My name is Cameron English. That handsome young man over there, Dr. Chuck Dinerstein, just boasting about his terrific Hawaiian shirt from the looks of it. And I like it. I see turtles. I see vacation-themed topics, pictures, martinis, beautiful stuff.
Yeah, martinis and shakers. Yes, it's a drinking shirt.
Beautiful stuff. We're excited to be here. Chuck's shirt is excited to be here. We are going to talk about one of our, or at least one of my favorite topics, and that, of course, is nicotine vaping, e-cigarette use. And I am really excited about this because this is a groundbreaking study. And by that, again, I'm being sarcastic. It's not a groundbreaking study. We can just add it to the giant pile of existing research we have showing that nicotine vaping is more effective than nicotine replacement therapy in terms of smoking cessation and helping adults quit. So let me read the...
Wait. Today, it's Change Roles Day.
Yeah.
Freaky Friday. So let me begin. The article, Vaping Superior to Nicotine Replacement Therapy, Yet Another Study Shows, was written by Cameron. And I'll just go with the beginning, and I'll let you take it from there. Nicotine vaping continues to outperform FDA-approved smoking cessation therapies in well-designed studies, including a new clinical trial conducted in Australia. This growing body of evidence badly undermines regulations that limit adult access to safer nicotine products that could save their lives. Take it away.
There you go. Case closed.
I'm so proud that I got to do the intro today.
It's very exciting. That's the second time in a month that I think you've done this. Okay. All right. Here's a quick rundown, and then we can break into some of the specifics, Chuck. So this was published in the Annals of Internal Medicine just a few weeks ago. This is a clinical trial, which, unlike a lot of the research we discuss, is epidemiological, where you're looking at population data and you're just correlating it with an exposure or with some behavior, and you're trying to draw a conclusion, which, for all the reasons we've discussed, is very difficult to do, and often those studies are bad, even in this space as well, in the nicotine science space. But what they're doing here, they took a little over 1,000 people, they split them into two groups. One got two vaping devices or e-cigarettes, and then the other one got nicotine replacement therapy in the form of lozenges or gum, so like Nicorette. You can buy it at CVS or whatever drugstore you want. And they compared the two groups, and what they found is that the vaping group was significantly better. They were much more likely to quit and stay quit than the nicotine replacement group. And this is not a surprising finding. There's been many studies that have looked at this. One of the other reviews I cite, or one of the meta-analyses I cite, is from the Cochrane collaboration, which is, of course, a very widely respected group. They most recently looked at, I believe it was 90 studies involving over 20,000 people. And this research consistently shows that vaping helps adult smokers quit better than any of the pharmaceuticals that are prescribed or nicotine replacement therapy.
So let me just interrupt. When you say quit, we're really saying quit smoking cigarettes.
Correct. They're still there. Well, many of them are still using nicotine for a period of time. That's true. Yes.
Okay.
That's it. Just that qualification. Yes, they are still using nicotine, whether it's NRT, whether it's vaping. They're still using it. It's a rough comparison to a lot of addiction treatment where you're substituting maybe methadone or something. I would say the degree of risk is much different because those are opioids, heroin and methadone.
Right. Numbers aside, but in terms of an analogy. What we're saying is that in the same way that methadone maintenance can resolve severe opioid addictions, the use of vaping as the nicotine substitute will get rid of a lot of combustible tobacco use. Mm-hmm. Fair enough?
Fair enough.
Okay.
Fair enough, yeah. Let's just run through a couple of the numbers here. Because this is good. So, for example, by the 7-month follow-up, because it was a 6-month study, they followed people for 6 months. That's another great thing that I should add before we go further, is that they're actually working with real people. They're giving them an intervention. They're following them for a time. They're getting, I think it was in the form of text messages, but they're getting behavioral support. hey, how are you doing? How much are you using this? How are things going?
Right.
They're monitoring them for adverse events, which is good. Like as far as trials go, this one's pretty decent. And it's not like you're not locking people in a hospital ward for months at a time. You're actually seeing how they behave in the real world. So I think this is actually very useful data that you're getting from a study like this.
And it was, they put them into a program. It wasn't, here's your vape pen, here's your gum, have a good day, get back to us.
Right. Okay, so just a couple of things. I think this speaks to the efficacy of vaping. So by the 7-month follow-up period, you had almost 60%, 56.3, I guess. We want to be specific. In the vaping group, kept using their vaping products at least weekly, compared to 30% in the NRT group. That's a significant drop-off. So that means that. And by the way, these are all adult smokers. They're low income. They're receiving government benefits, which, of course, as we've talked about before, is an important proxy for your likelihood to smoke and drink and do other things at a level that's harmful. And so this is not only are these people sticking with the treatment, but they're a group that's at much higher risk for tobacco-related illness. So this is a big deal that you can keep these people on a treatment that's working for them. And one of the things people will say is, there's all these adverse events related to vaping. It could cause cancer. We just don't know yet, blah, blah, blah. Nonsense. But when you do studies like this, what you find is the adverse events in both groups are rare because nicotine by itself is actually relatively benign. It's not that harmful in the doses that most people consume. But you actually saw more adverse events in the nicotine replacement group. So we see, there's a lot of weeping and gnashing of teeth about the risks of vaping to the developing brain, and nicotine could cause cardiovascular effects, and et cetera, et cetera, et cetera. But the impacts in this study and others have actually been worse in NRT. Not to any degree that's harmful, but the point being, if that's going to be our threshold for harm, then we need to start getting Nicorette off the shelves right away. Like, we got to start pulling this off the shelves because it's got this highly addictive chemical that threatens our children, don't you know?
So it would seem to me, one question to ask is why you think that vaping was so much more effective than Nicorette, just to pick one of the other therapies. What's the magic of vaping?
There's several factors. I think the most important is the behavioral aspect of it. I think any addiction expert will tell you that it's the ritual of the addiction that is a very strong component of keeping people using any substance or engaging in any behavior, right? You come to ritualize it. And so, for example, when I was a smoker, and I still use vapes a lot less than I used to. Interestingly enough, that's something we can get to in a minute. But one of the reasons it works so well for me is because one of my favorite pastimes for years was getting up early on a Saturday morning with a pack of Camel Lights, which are no longer called Camel Lights. You can't call them because that's yucky to imply that they're better somehow. Anyways, I would get up with a pack of Camel Lights, whatever book I was reading, and a giant vat of coffee, just a giant pot of coffee, and I would chain smoke. I would drink my coffee and I would read my book and I would watch the fog burn off the morning skyline. And it was just a little slice of heaven. I loved every second of that. And I did it as much as I could, as much as my schedule allowed. So when I switched to vaping, I was able to maintain that habit, which actually on balance is quite good for you, right? I'm reading a book. I'm getting up. I'm starting my day with a good routine. You know what I mean?
I hear you.
Yeah. So those kind of things, are important ritualistically. And so if you can maintain a habit like that while excising most of the harmful elements of burning tobacco, the combustion elements, that's a really big step forward. You can't do that with Nicorette. Like, I could get up and I could pop a few pieces of flavored nicotine gum, which of course is illegal in the United States for vaping, right? You cannot have legally flavored vapes. But in other words, Nicorette, any of the pharmaceuticals like bupropion, like the antidepressants, none of those replicate that experience that people enjoy about cigarette smoking. And so,
well, I think that's key. I mean, it's kind of why I asked that question, because I think that it does allow for you to continue the ritual in many ways. There's something in your hand, you're inhaling something, you're exhaling something. You can sit outside and talk with your friends on the for 5 or 10 minutes. It's very much like, what you describe in terms of getting up in the morning and reading the newspaper or whatever it is. It flows very well into the ritual so that it doesn't break that part of the habit, but it does seem to get rid of most of the harmful chemicals. Though I would, say in all fairness that nicotine does have cardiovascular effects, and I don't think that there's any good evidence at all yet about the effect of nicotine by itself in the long term, just because vaping has not been around long enough for that kind of cardiovascular latency to rear its head.
I would agree with that, but I think the context we need to apply is that that's necessarily true because we can't predict the future. So for example, if our beloved HHS secretary was to say, the COVID vaccines could have severe long-term consequences, we just haven't had time to accumulate the data, everybody in science and medicine in unison would stand up like seals and they'd go, "You're not allowed to say that because the studies we have show that the COVID-19 vaccines are safe and effective." Right? You already know the line that would be repeated. Now, listen, while that's true, I got all my kids have all their vaccines. I got the COVID-19 shots. I have no problem with any vaccines. I nevertheless recognize that there is a double standard when it comes to study methodology, depending on the product under study. And because there's some sort of a stigma attached to nicotine use.
Well, wait a minute. Not study methodology so much as study interpretation. Methodology.
Fair enough.
Methodology's not going to, let's leave that aside. That, I think it can be the case that, and interestingly enough, I think what you're really saying is that when you don't like the short-term data, the people that don't like the short-term data will then turn to, but what about the long-term data? And depending on what topic it is how that may play to your individual sensitivities, as you demonstrate by talking about vaccination versus vaping. Fair enough?
Yeah, it's a fair point of clarification. But I think the reason I said methodology is because people will design, like the COVID clinical trials. How long were it? 3 months, 6 months, I think? The initial, yeah. Okay, so we're less than a year. And of course, we're in the middle of a pandemic. Let's get the shots out and let's save lives, provided we know the shots carry a reasonable risk profile, 100%. But now all we have is we have surveillance data through Health and Human Services. God only knows if that's going to continue. But that's once a vaccine or any pharmaceutical is licensed, we have surveillance data and we monitor the trends and we try to see if we can pick out a signal if there's any side effects that appear. And we do the same thing with tobacco, right? We have the National Youth Tobacco Survey. There's the behavioral health surveillance system. There's multiple ways that we monitor this. And so I think that argument needs to be shelved because, for one thing, vaping isn't that new anymore. We're dealing with almost 2 decades, right? So that's plenty of time to at least see a trend towards certain things, right? Like maybe not most cancers, but you would certainly see worsening effects, right? Like you could see biomarkers of inflammation. You could see things in people that would go, wait a minute, things are actually getting worse. This might be a problem.
I think you might. I don't know that 20 years is sufficient, again, because of you have to take into account how long it took for vaping to penetrate the tobacco market, how it's really shifted. I mean, at this point in time, I think there's probably more people vaping than smoking, or that the numbers are starting to equalize. So I think you're going to have to wait a little bit longer to start to be able to see a signal, because your sample size at this point may be too small. And again, it's going to be confounded right away by the dual users, by the people that smoked for 20 years and now they vape for 10. So how do you do you count them as a 10-year vapor or a 20-year smoker? Or, it's confounded data at this point. You're not going to get any. I don't think you're going to get any real clarity for a little bit longer. But to your point, that may, for dealing with the acute situation, this represents as the study shows, a significant means of harm reduction from something that we already know chronically is bad.
Yeah. One observation, I think you're right. We always do this. Once a product is licensed or authorized or approved or registered, we just monitor the population that uses it to see what happens. That's going to provide valuable data. But one of the ways you can try to suss out those confounding issues you were talking about is you can take, you can't do a clinical trial because no one will do it. There's no ethics review board will authorize it. But you can monitor epidemiologically people who smoke, and you can compare them to people that vape. Or you can do some sort of a crossover approach where you take smokers who've agreed to quit and you take their baseline numbers, whatever metric you're looking at, and then as they switch over to vaping, you can monitor the changes that occur. And it's going to vary, like for cardiovascular stuff or lung health, it's all going to vary depending on whatever you're looking at. But you can see positive trends, and this is why it's promoted as a harm reduction method. Now, sadly, the products that have been approved or authorized, by the FDA can't be marketed that way. You're not allowed to say that vaping is safer or lower risk than smoking. The government will not let you do that, even though they know it's true. So that's part of the problem. People will sometimes complain that these products are not marketed as cessation or harm reduction tools, but that's because there's a federal government that will crush your head under its boot if you even hint.
But that, which is in contradistinction, say, to the United Kingdom, where it is recognized as a means of harm reduction.
They have
marketed that way.
They have vape shops in hospitals in the UK. Now that might change because there are forces within their government that are trying to regulate the products more. But for now, there's some hospitals where you go in and the doctor will say, "We've got a vape shop down the hallway. They'll get you set up. Stop smoking." Well,
in all fairness, I would point out that the University of Pennsylvania's Children's Hospital did have a McDonald's. So
yeah. If we want to go in the opposite direction, Let's see, what else can we say about the study? One of the things that often bugs me about the research in this field, Chuck, is that the way we define smoking and vaping, or dual use, for example. So at studies we've looked at previously, they will take a single puff of a cigarette as a relapse to tobacco use, which is comically dishonest, right? Because if that's your definition, then almost automatically anyone who attempts vaping has failed, because most people, or many people I should say, do dual use. They continue smoking a little bit, but they significantly reduce their cigarette intake. And then over time, most of them switch. This is what you see in the studies. So what they did in this study is they didn't say, if you have a puff of a cigarette, you're a loser and you have failed, right? You're out of the trial or anything. They said we define abstinence as having 5 or fewer cigarettes, which is still pretty tight, but it still takes account of the fact that you might have a moment of weakness 3 months.
People
study. Yeah. So in other words, if you say, "Did you have 5 cigarettes?" Someone might go, "Yeah." Well, it's like, well, if that's it in 6 months, you're doing pretty damn good. So that's another thing, and I think that might have to do with some of the people behind the study who are excellent nicotine researchers. They understand some of these subtleties, because one of them is a physician who actually treats smokers, which unsurprisingly gives him a little bit better insight into smoking behavior, as opposed to these academics at UCSF and these other places that are on a crusade to eliminate happiness in any capacity. So
nice. Very nice.
Anyways, that's my humble, unbiased opinion. Maybe we should say this isn't for kids. Kids shouldn't use nicotine. I agree. I have 2 kids. I don't let them use nicotine. I'm not going to let them use nicotine. If you don't smoke already, don't vape. Right? Same thing, right? If you don't, if the vaccine isn't for you, then don't take the vaccine. Same thing here. Same principle.
Right. I think, again, this is, we've always offered this as a harm reduction tool. I think there's another calculus for taking up vaping to begin with versus not at all. But that's a topic for another day.
Yes, indeed. Yeah, but let's get people off cigarettes. Cigarettes still kill people, still the leading cause of death and disease in this country in 2025. So let's fix it. We got the tools, but that's, again, I could go on for another 8 hours. I won't do that. Go read the article. It is called "Vaping Superior to Nicotine Replacement Therapy. Yet Another Study Shows." That is at acsh.org. When you go to the website, click the subscribe tab, punch in your email address. We will send you the articles we publish. The ones that you read are usually the ones we talk about. We are on X, Instagram, and YouTube. American Council on Science and Health Matter of Facts. Our colleague Anna Dalaski is doing great videos on Facebook, Instagram, and YouTube. 30 seconds, 1 minute, just breaking down your questions about science and health topics. And it's good stuff if you want to be a little more informed. Thank you for joining us, and we will see you next time.